Sean Hook's Newsmaker Saturday starts now.
Thanks for joining us on Newsmaker Saturday. Later in the program, we're going to talk to the Border Patrol Union head, Brandon Judd, about the situation on the border. He's got some fascinating perspective after 24 years in Border Patrol, now Customs and Border Protection. But we're going to begin with the people in the healthcare field who are not getting the vaccine. And this is, we've heard the numbers from the hospitals here locally this week, that there's about 95% compliance. But there are people who don't want to take this shot for various reasons, and we're going to talk to one of them. A nurse, Bethann Hnat, 15 years a nurse at Honor Health. You resigned September 17th, and we're going to get into why. Bethann, thank you very much for joining us on Newsmaker Saturday.
Thank you so much for having me.
Tell me why you did not want to get the shot and you gave up a career over this decision.
Sure. So a little bit of a backstory is that about 7 years ago, the rules and regulations changed as far as the annual flu shot was concerned, and those became mandatory. So having been a nurse with the personal option to just say yes or no, that existed in my world as a nurse. And then it changed and we had to enact an option for either a medical or a religious exemption. So when all of this started coming around again, it felt very familiar. It felt like something that I had already experienced, something that I had already been advocating for, which was for everybody to make a choice that was best for their own bodies, which is really what this is all about. I want people to know that unfortunately, we get kind of labeled or we get called certain names or there's slogans that are used, and that's not it. I want every person in and out of the medical field, every parent for their child, to make the best decision for them. So amongst all of this happening, the unfortunate part for me was that the trend was continuing where I could not, in good conscience, consent to something that I did not know enough about. And I was struggling to get my questions answered as far as ingredients, as far as long-term safety studies, efficacy studies. And there is counter data that things amongst our natural way of living will help not only prevent getting COVID, but will also help you in your recovery. And I wanted to be able, as a human being, to make that decision knowing that that was what was best for me. It was not of malintent to any of my coworkers or my patients. I'm a prudent individual. So, before, if I've ever been sick, I stay home. And I didn't feel like we had enough of an answer as far as long-term safety, efficacy data for me to succumb to the pressures of this.
How was that received by coworkers, first of all, and then administrators, secondly?
Coworkers are split, honestly. I wouldn't say split as far as like a 50-50 ratio. I say split, meaning some that share my perspective and some that don't. I know plenty of nurses that made their personal decision to get it, and I love that decision for them. They made it based off of, hopefully it was out of what they had read and they felt like it was going to offer them the protection that they needed. But whatever their reason was, I support that reason. I equally, in turn, want to have my reasons supported for why I chose not to. And I think it became a contentious topic, unfortunately. We were feeling a lot of pressure. We were receiving emails that we were going to have one-on-ones with our supervisors or administrators to kind of figure out what our plan was. There were deadlines for everything. And again, we have laws that are in place to protect anybody that's undergoing a medical procedure. And this is a medical procedure. It's an injection of something into your body. So I have the right to receive informed consent. And like I touched on earlier, I didn't feel that I was getting all of my questions answered. And so then to have to turn and enact an exemption just because I can't provide informed consent didn't really sit well with me morally and ethically. I didn't feel like I had to divulge things that were personal and sacred to me when the crux of the issue is that I didn't have the option simply to say no, and they could not provide me with answers to my questions
Let me
that I
ask
had. So
a couple of things here. Is a flu shot something that you're comfortable with?
I personally do not receive the flu vaccine. I've never had the flu. I maintain a relatively healthy lifestyle. You know, I try to eat well. I try to exercise as best I can. You know, I take vitamin D. I get sunlight. I get fresh air. I try to maintain a good spiritual health, emotional health. So it isn't something that I have ever felt is a necessary component for prevention for me. And again, there are people that feel that. And so if they feel that that is an extra little bonus or a boost or something else that can help them in their prevention for the flu season, great.
You're all for it. Let me ask you, you know, in
wonderful.
Arizona, the vaccination rate right now, we're at about 61%. And I started looking up what's the compliance with the flu vaccine, and it's about 63%. I kind of think we're kind of hitting a ceiling here. The people who are not getting it are making a choice not to get it for whatever reason. I'm not sure we're going to get to a 70-something% vaccination rate on this thing. Do you?
I'll be honest, I don't think so. And just to kind of touch on that before, I would say that amongst healthcare workers, the one major reason why we saw an increase in flu vaccination compliance was because they enacted a caveat in the religious exemption form that required you to wear a mask during the designated flu season months, whatever the hospital dictated those to be. So folks like myself that opted to enact the religious exemption form for the flu shot, we wore masks for upwards of 5 months out of the year.
Wow.
Perfectly healthy people parading around in a mask. And again, now that might not sound abnormal because that has been what people have been doing. But when you're on the minority side of things, everyone knows, everybody knew in the hospital that I did not receive my flu shot because I had an outward appearance that was changed based off of that exemption. So I think the same people that perhaps feel the same way, although I will mention that I know plenty of nurses that typically receive the annual flu shot that are opting not to receive this. And I think that falls into a lot of categories
and the
like
same misgivings
the newness
that you have. Yes.
Yeah, they have chosen not to do this for a variety of reasons. One of them being, I think it's so brand new. We don't have a lot of long-term data. There's new ingredients and it's a new kind of quote unquote technology of its mechanism of action and it's how it's working. And so that I think plays into some additional reasons as to why people aren't participating.
Let me ask you about this. We've got right now, the hospitals this week came out somewhere between 93 and 95% compliance. Do you believe that number? That the hospitals are telling us? That's what we're reporting, that's what the hospitals are giving us, or do you think there's more?
Unfortunately, I don't. Unfortunately, I don't believe that. And the reason why I don't believe it is just because I personally know so many people that chose to participate in the religious exemption option, which means they are unvaccinated.
One more quick thing before we go, because we've only got a few seconds. Do you believe that this is adding to the nursing shortage?
I do. I think that it's adding to some of the trepidation also of people wanting to become nurses, is that you have to sacrifice even more of yourself when you join healthcare. But I think that people are taking a step back and going, we give so much of ourselves caring for other people. We leave our families to care for others. So I think it is. I think some people are stepping back and saying, it's an overreach that we're just not comfortable with.
Bethann Hnat, thank you very much. I appreciate your perspective. It's good to get it out there. Thank you.
Yeah, thank you so much. I appreciate the time.
Best of luck. When we come back, Brandon Judd, head of the Border Patrol Union. He's been at this for 24 years. What does he think is going on the border? What is going on with this incredible surge, historic surge we're seeing when we return on Newsmaker Saturday? Back on Newsmaker Saturday, we're going to spend some time here in the last part of the program talking about the situation at the border, which I think anyone who's rational would say is deteriorated. We are on pace to reach 2 million border crossings this year. That is the largest surge ever since they've been keeping records going back to 1960. Why is this happening? Is there anything we can do to stop it? Or as some have posed, we are a nation of immigrants and this is good for the country in the long run. Brandon Judd serves as the president of the National Border Patrol Council, representing more than 17,000 Border Patrol agents and support staff. He brings with him about 24 years experience as a Border Patrol agent on the ground. Brandon, thank you for joining us. We appreciate it.
It's good to be with you. Thank you.
Okay, Brandon, you've been there. You've been on the border a long time. You've seen this up close. What is happening right now that is so different from what we've seen during surges in 2000, even in the late 90s?
Well, the main thing that we're seeing right now as it pertains to surges is where people are coming from. In the late 90s, early 2000s, the vast majority, 95% of the people that were crossing the border illegally were from Mexico. Today, that number is down in the 60% percentile. We're seeing people from all over the world. We're seeing people from Russia, Uzbekistan, Bangladesh, Senegal. We're seeing people from every single continent and countries in the world. The United Nations officially identifies 195 countries. We've arrested people from 161 of those countries.
Wow.
So that's a lot different.
So what does that tell you? What does that tell you? Because what we're being told, the Biden administration said we're going to have a more humane border policy. And these are ostensibly asylum claims that you're fleeing some kind of religious persecution or governmental persecution, that you're in danger, your life is in danger. But it strikes me that the lion's share here, correct me if I'm wrong, are economic immigrants.
They are. The vast majority of the people that we see are economic immigrants. What it tells you, and the reason why there's so many people from all across the world, is the criminal cartels, the organizations, they're able to go into countries that they hadn't been able to go into before, and they're able to advertise their services. They're able to convince people that if they pay them X number of dollars, they're going to be able to smuggle them into the United States. And by the way, they tell them, if you get caught, it doesn't matter, you're going to be released anyway. And that's the magnet that draws so many people across our borders illegally. If we continue to release people, if there's no consequence for violating our laws, if we reward people by releasing them into the United States, these cartels are going to be able to advertise their services, and we're going to get flooded with illegal immigrants.
Well, and that's exactly what's happening. And isn't the rule that for an asylum claim, you need to surrender yourself at a port of entry, a checkpoint, correct? A lot of these are in between points of entry where you're interdicting people coming across.
So the laws simply say, our laws simply say that you have to present yourself in the United States. So you can make a crossing illegally and then claim asylum, and your claim still has to be adjudicated. But that first act was a violation of our laws. And the reason that they're crossing between the ports of entry is that's where the smugglers are sending them. That's where the cartels are telling them to go, because they want to flood our resources. By flooding our resources, it pulls our agents out of the field, and when it pulls our agents out of the field, the cartels create artificial gaps, and they're able to cross their higher value products such as opioids, methamphetamine, cocaine, or even criminal aliens through those gaps that they create. That's why they're crossing between the ports of entry. But they can still claim asylum even if they cross between a port of entry and violate a law.
Okay, so for the smugglers, it's heads I win, tails you lose, because they get the money from the human cargo they're smuggling. Plus, they're doing ends around into places where you're not anymore because you're processing people, and they're moving contraband, drugs.
That's exactly what's happening. When you look at the amount of revenue that they're able to generate through illegal immigration alone, through human trafficking, they're generating at a minimum $400 million a month in human trafficking. Then you add on top of that the drug smuggling, the contraband, and that number goes up astronomically. It's crazy to see what is happening today, and it's all driven by policy, and that is what is so frustrating to Border Patrol agents. There are simple solutions to this problem. This administration, unfortunately, just doesn't have the political will to implement those solutions.
Do you have any idea why they're doing what they're doing? Because, I mean, the public polling on this is pretty clear. at least 70% of Americans, they don't like what they're seeing at the border. The number may even be higher. They just don't like the chaos. They're not anti-immigrant, they're anti-illegal immigration.
That's exactly correct. I mean, we are the most compassionate country in the world. We take in more immigrants year over year than any other country in the world, and we should be the most compassionate country in the world based upon the blessings that we have. But if you look at the why, that's what we always have to look at and say, why is this happening? Why is this administration implementing policies that are so detrimental to the American public? And the answer is very simple. They have to energize their base. Everybody knows that in elections, you must have an energized base. If you don't have that energized base, you don't get people out to the polls. And so this administration has thrown away what's best for the country in order to appease that far left base.
I'm failing to see where unbridled illegal immigration motivates anybody.
Well, you got open border pundits. I mean, all you have to do is look at the special interest groups.
That's a small segment, though, isn't it, Brandon, that really believes in open borders?
It is a small segment. It's a small segment, but you're still looking about 30% of the Democratic electorate. That is a huge number. So again, you have to rally your base. And when you look at, look at in Congress right now, in reconciliation alone, they're still trying to pass an amnesty. They're still trying to pass some form of amnesty, even though the vast majority of the American public says no, not until you get the border secure. But they're still trying to do it. They're still pushing towards that. Again, it's all about their base voter.
Okay, I've got to ask you this. This was one of the most curious things I came across. The president has sent the vice president to discuss the origins of why people are coming from the northern triangle of Honduras, El Salvador, Guatemala. That's 700,000 people who've come across the border from those northern triangle countries. So we're spending a lot of time worrying about that. But the single biggest country moving people across our southern border remains Mexico. 655,000 from Mexico. So even though we talk about the Northern Triangle, the single biggest country still coming across is Mexico. I don't understand.
It is. Well, so this is all about redirecting the conversation. This is about deflecting on the failures that this administration has. And so they talk about root causes, and they talk about root causes that exist in other countries. The last time I checked, our government cannot control what other governments do. We just saw that in Afghanistan. When she says that climate change, when she says that no jobs, economic, political upheaval, when she talks about all of those different things, those factors have existed since I've been in the Border Patrol for over 24 years. What we can control is what happens right here in the United States. That's what we control. We need to look at those root causes. We need to look at those magnets that are drawing people to cross our borders illegally. And again, like you said, the vast majority, a majority of people are coming from Mexico.
Still,
and she doesn't talk about those root causes.
Okay, so in a perfect world with Brandon Judd running the border, what would be the things that you would change right now that could fix this and at least make it not as chaotic?
This is very simple. This administration said that it's inhumane to have people wait in Mexico pending their asylum or deportation proceedings. Simple. Hold them in custody here. Stop releasing them into the United States. The moment we hold people in custody pending a hearing, they stop coming because they're not going to throw their money away to the cartels. They're going to stay in their own countries and try to make their lives. But when we release them into the United States, they're going to continue to come because they've been rewarded. You must hold people in custody pending that asylum or deportation proceeding. If we did that simple thing, that would be the solution to illegal immigration. On a large scale like what we're seeing today. There's always going to be illegal immigration because people are going to try to evade apprehension.
Sure.
But on the large scale that we're seeing today, that would solve the problem.
Okay, so we've had a big, the single biggest number coming across still remains single adult males. Mm-hmm. But you do have a big family contingent and a lot of minors coming across. Is that what ties you guys up? You become almost social workers down on the border.
We do, and it is what ties our hands. That's what pulls so much of our resources out of the field and puts us into what we call processing centers, rather than being on the border patrolling and trying to go after the profits of the criminal cartels. Again, these cartels, they understand, they know business, they understand what they're doing, they know what they need to do, and they flood us in certain areas knowing that they're going to pull us out of the field, and they flood us with certain segments, with unaccompanied children, with family units, and then they cross the single adults trying to evade apprehension.
And when they come across, are they well coached as to what to say about asylum claims? Is it always, I'm claiming asylum? Is that what you get?
Yeah, so what they do is they don't necessarily use the word asylum. All they do is they say, I fear going back to my country. And once you say that, then we have to put them in those proceedings. It's our laws. Again, we're our compassionate country. It's our laws. What the problem is, we just don't adjudicate it on a timely basis. And because we don't do that, our system gets backlogged.
How many people are checking in? Because I hear vastly different figures depending on what publication you're reading of how many actually report when they're given a court date to appear.
Well, so those figures are going to vary because there's a series of court dates. It's not just one court date. So the vast majority are going to show up to their initial appearance because they want to get their work permits. They want to get their driver's licenses. They want to be able to send their kids to school and get all of the public benefits. So they will show up to that initial court appearance. What they don't show up to is the court appearance in which they have to prove that they have a legitimate reason to be here in the United States. You got to remember, because this is an administrative process, not a criminal process, the burden of proof is on them, not the government. And so they have to go to court and they have to prove that they have a legitimate reason to be here in the United States under our laws. They can't do that. That's why they don't show up to that final appearance that is going to give them an order of deportation.
And in the meantime, how long are they in the country before they get to that final step? Usually.
Oh, that can be years. On the low end, we're talking 2 years. On the high end, you're talking about 5 years. So yes, they're being rewarded for those number of years. And through that period of time, even though they violated our law, when we release them, we're giving them a de facto legal status to be here. And with that legal status, they're able to get all of those benefits that I just explained. And that's what they're looking for. That's why they're giving up. That's why they don't care whether or not they get caught.
They're well aware of all the things they are afforded here. They know what the parameters are. They're well briefed on all of this. They are.
Yes, social media works in every country, and it's very well explained. The cartels, in their advertising of their services, they also explain all of the benefits that they'll get if they come to the United States illegally.
Brandon, one more thing. Who decides where these people go throughout the interior of the country? And do you sense that there's any political motivation as to where they're placed? In other words...
No, the government doesn't place these people. The moment we release them, so let's just use the Border Patrol as an example. When we take people into custody, when we release them, all we do is take them to the nearest transportation hub, whether that's the Greyhound station, whatever that transportation hub is. Once they're released, they decide where they go from there.
Okay, and Catholic Social Services and other organizations help move people around, right?
They do. So so let's use McAllen, the ground zero for illegal immigration right now. In McAllen, what we'll do is we'll take people to the Greyhound bus station. Catholic Charities has set up shop right across the street from Greyhound. So when we drop them off at the bus station, they go over to Catholic Charities. Catholic Charities then helps them to facilitate that travel to wherever they're going, whether that's Des Moines, Iowa, Miami, Florida, even Bangor, Maine. I mean, they're going throughout the entire United States.
Brandon Judd, we really appreciate your time. It's good. We've been trying to book you for a while, and we appreciate it. We appreciate you. Thank you.
It was good to talk to you. Thank you.
Brandon Judd with the Border Council. As we go to break, let's give you the website where you can find past shows on Newsmaker Saturday. This is because people always ask, hey, I want to see that show from last month where you interviewed the climate scientist. Well, fox10phoenix.com/newsmaker. There you go. That's where you do it. We're back in a minute on Newsmaker Saturday. Thanks again for joining us on Newsmaker Saturday. I want to let you know there was a part of the Brandon Judd interview that went on after the interview that is very interesting stuff, and you can get that on Instagram or on YouTube, Fox 10 Phoenix. It's there. We had a very frank discussion about some other issues about the border you may find very interesting. Thanks again for joining us. We'll see you next week on Newsmaker Saturday.